Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people that you do business with. And we're thrilled today to have Dr. John Calado of MDVIP on with us. He has a very interesting story and a big change that he made in his career to basically take better care of his patients. So we're going to talk about that and what MDVIP has to offer for you. So, Dr. Calado, first of all, thanks for joining us in your busy day.
Thank you so much for having me.
So just to kind of set the stage here, tell people a little bit about yourself and the big transition that you made from having your own practice for 20 years. And then 6 years ago, you shifted to the MDVIP model. And why exactly did you do that?
I'm internal medicine. I've been staff at Beaumont Troy for the past 24 years. I think all of us as physicians start off that we wanted to do really the best that we can for our patients and spend as much time. But over the years, things became tighter and tighter, having more patients, spending less time, not being able to do all the thorough things that you want to do with a patient. And then you start feeling that by the end of the day or at nighttime, that you're always milling through your head, did you do enough for your patient? MDVIP then approached me and they were asking if I've noticed the things that are going on in terms of decreasing ability to see patients in time frame, being able to do all the things. And I told them yes. They helped me transition to a point that I don't need to see thousands of people. I can take care of select few hundreds of people who want to have closer care. And that gave me the opportunity to spend more time with them, to be more thorough, and really move my practice into a forensic look into a person's health. And I greatly appreciate that ability that MDVIP provided for me as a practitioner. I started getting burnt out, having to see anywhere from 30 to 70 patients a day, and then now being able to see less than 20 in a day to be able to do a lot more things, whether it's pre-authorizations, trying to figure out their health because they've been going doctor to doctor and not being able to get the care that they need or find out the problem, and really help them find a way that they can improve their quality of health and their life.
Yeah, to scale down from potentially as many as 3,000 patients at a time all the way down to 600, I think that speaks volumes to how important it was for you to personally take care of each individual patient. That's really the best way to diagnose problems and fix them. So let's talk a little bit about that transition to MDVIP. And they don't just let any physician on there. You had mentioned to me that 1 out of 12 actually get accepted. So that should show our listeners that you're getting top of the line care here. What was the process to be part of MDVIP?
Well, first, MDVIP had to invite you. So they actually did their homework ahead of time to find out what type of physician you are. Are you really vested into your patients? Do you really care? Do you have outstanding reputation in the community? And then they meet with you and they go through criteria to take a look at your patient population. They do a survey analysis to try to determine how likely or what's the perception of the patients that they have about you. Do they love you? Do they appreciate your care? Do they understand that you are adept and have the intelligence and in the care for them? The criteria really, there's probably over 30 different criteria. You have to pass them 100%. If one piece of it at all is off, you're not accepted. So it's really difficult to get in. And for me, the knowledge of knowing that my colleagues or the other affiliates have been interviewed the same way and have been vetted the same way in coming to this program makes me feel very comfortable if I have to refer my patient to another MDVIP affiliate. And what I mean by that is that if my member travels to another state and they become ill, instead of them going to urgent care or emergency room, if they're not that terrible and there's something that we can't really care for by phone in our discussion, and I need them to be seen by my colleague, then I know I can trust that they're going to take care of them very similar to what I'm going to do. And the reality is that if my patient travels, let's say to Texas, and my patient ends up in the hospital, that patient is going to be now taken care of by a physician that I don't know. And on top of that, they're going to be taken care of by specialists that I have no idea to make a recommendation to care for that person. But me knowing that my MDVIP affiliate or partner ends up now knowing all the physicians, the specialists in that area, knows the hospital systems in that area, can help to coordinate the care that my member that's traveled out there, and I know that they're going to be seen by the best specialists. They're going to be cared for on a timely manner, and they're going to be cared for respectfully and in such a way that it can expedite their care.
That's fantastic. And I hadn't thought about that, but the out-of-state network like that really has you covered wherever your patients might be at any given time. You never know when a medical need might arise, you know? Um, so let's talk a little bit about this subscription model here. Okay, so I think the important message is this should not replace your medical insurance. People shouldn't go out and cancel their medical insurance and subscribe to this, but it's a great supplement to medical insurance. So first of all, explain to people what they get for their subscription, all the different checkups that you cover, and why economically it makes sense to have this in addition to medical insurance.
Yes. So in the MDVIP model, MDVIP believes that there are a set of tests that need to be done in an individual to define their health. But a lot of that's very difficult in the traditional model of caring for people, because if you do the testing, it has to be then cleared by your insurance. And if your insurance doesn't clear it, then you have a test that's missing in the group of tests that are required. In the MDVIP model, everybody gets vision testing, hearing testing, lung testing, cardiac testing, body mass testing, vascular disease testing, a psychological profile, so we have an idea of what that person's perception of themselves are, so we know what we can focus on, that they'll know how if they're getting better or not, because we know that's how they feel. There's also testing that we can test for a person of early dementia, and there's grip strength to find out about if someone's losing strength over time, and also a walking test to determine if the person's gait is abnormal, and also if they're slowing down or they're getting faster. So this whole set of tests are very important because it helps to define the person's functionality, along with examining them and also reviewing their medical history. So once you have that, you really can get a comprehensive look at an individual and really develop a treatment plan that is very individualized and really personal to that person, to try to improve their quality of life and their health. I always tell people that we all work like crazy to get to a certain point. I don't like the word retirement. I'd rather say that we're working to a point that we want to rewire ourselves, because we're working to a point that we can slow down and maybe do the things that we've always wanted to do, but we never had the time because we were raising families, we had a career, and the responsibilities related to that. But when you get rewired, you don't want to spend that time in and out of the doctor's office. You don't want to spend that time in and out of the hospital. You don't want to spend that time with, worse yet, a deficit, that you had a stroke during that time and now you can't move one side of your body and you can't feed yourself, or you had a heart attack and now your heart's weakened and so you're having frequent episodes of congestive heart failure. So you need that all defined ahead of time, so that by the time you get to your rewired stage, and even before that, you want to live your life to have this best quality, the best functionality. And so it's sad when I see people working really hard and they get to that point and they've neglected their health, and that now they have these deficits and they can't do anything else. And then they go into this retrospective look at their life and saying, why did I do all this? And so this program helps us to define those things so that we can make things better for an individual. And if someone had to piecemeal this, and let's just say they had to go and have these tests done, first they would have to get it cleared by their insurance, whether it's going to be covered. If it doesn't get covered, and let's just say none of them gets covered, it probably would be close to about $5,000 out of pocket just to get those tests done. So here, the program's $1,800 a year. The person, it's because we're not a concierge service, we're a personalized healthcare program. It's tax deductible. People can pay it on their FSA or their HSA. So many people get their money back from it.
Rewire versus retire. I love that, man. I think I'm going to use that. That's a great way to look at it from a happier perspective. And you're right. I mean, people live longer than they ever have before, but then what kind of quality life do they have in those golden years? Do they take care of themselves ahead of time? And this is way beyond just your yearly physical, all these thorough tests. You're getting everything checked up in great detail. So, that's way above and beyond an annual physical, correct?
Yes. So to understand the issues of insurance, you can have actually any insurance you want. I always tell people that this is essentially this would be similar to doing an executive physical. Those individuals have their regular insurance and then they go and travel to Cleveland or Mayo Clinic or John Hopkins to end up having that annual executive physical, and they pay for that out of pocket as a separate thing. But they still go to their primary care physician and take care of that. We are actually listed in the top 10 of giving executive physicals. So the difference is that your executive physical is now with your primary care physician. And the importance of this is this. Before I became MDVIP, I had some patients who ended up going to have their executive physicals done at Mayo Clinic or Cleveland. And then I would get this packet of all this data. And at the time, I wasn't doing these things. Even though I did thorough, there were things that part of this that I was not doing. And so as a primary care physician, then you get kind of perplexed. What are you going to do with all this data? But for us, we do this day in and day out. Every year we do this evaluation on a person, and we can do an annual comparison for that person's comprehensive evaluation or executive physical. And so with your insurance is the same. So even after that yearly fee is to cover that one time a year that you do the comprehensive with the labs, and then you meet with us, and then we sit down for me, generally I sit down with them for an hour to 2 hours to go through everything head to toe, so that they know their whole medical history, all the testing that they had done, their MDVIP testing, and then we define each medical issue that the person has and set up a plan for each one of them. And so whether someone had something done at Cleveland Clinic, or they had something done at University of Michigan, or had something done at Beaumont or Henry Ford, for me, I consolidate it all into one place so that we're not searching for things all over the place, and that we can look at it really quick and say, when was the last time you had your heart test? And we know what the result is because we can just stroll through it and say, you had it in 2018, this is your echo, your heart was pumping at 65%, and that all the walls were moving, no significant valve issues, versus trying to search all over the place and trying to guess for things when a person might start feeling a little weary as a physician and not really look back and say they're just guessing. Well, I think your echo was done maybe about 3 years ago or 5 years ago, and maybe this was the result. Because the reality is I was there. I was getting burnt out seeing several thousands of people, and I got to a point that I couldn't do it anymore. And I said that I have to make things better so I can care for people on a better basis who want this personalized, this close attention to detail care.
That's awesome, man. And just beyond the checkups, emergency situations happen too. Urgent care needs come about. So you put your cell phone number out there, you're very, very accessible. I think that's another big advantage of MDVIP. So tell me about that a little bit, the urgent care and emergency services you be able to offer.
So all of us as MDVIP physicians have our cells or contact numbers for all our members to call us if there's an urgent or emergent situation. For me, I always tell my patients, look, if you can't go to sleep because you're so worried about something, don't worry about calling me. Just contact me. I'd rather you contact me if you're worried and afraid, and that maybe it's something that's a discussion for us to have for half a minute, or 5 minutes, or 10 minutes, or even 20 minutes, just to assure you that you're going to be okay. Because it's sad for me to know that someone has been in pain through the night, or that there's been an issue that a person's been afraid all night of something that's going on, when it might be just a quick phone call to say, no, everything's fine, or no, please go to the hospital. I'll call the hospital in advance. We'll get everything moving ahead of time so that we can expedite your care. But yes, they have our cell number. They'll have other contact numbers so they can reach us for any urgent or emergent needs. And generally, if we need to see them that same day or the following day, we make accommodations, generally see them within 24 hours.
And then, beyond all these other services that we've talked about, there's acupuncture that you currently offer, and then soon you'll have your nutritionist and Pilates and yoga available on site. And these are additional services that people can purchase. But talk about that a little bit, especially acupuncture, which I always find is interesting. I mean, it's been around for thousands and thousands of years, so it must work, right?
So acupuncture, acupuncture, I think the thing is on the Western side of medicine, I think that there has been such a bad arrogance that we've had, that we haven't really explored the fact that Eastern medicine could really help our patients. And I think for me, the use of both Eastern and Western medicine has tremendously helped to decrease the amount of medications that a person needs and actually increase their functionality. Our acupuncturist came from Cancer Treatment Centers of America. He's absolutely amazing, Daniel Devine. His task was to take care of every cancer patient and try to help them feel better so they can continue their cancer treatment. So if you imagine these people had surgery and chemo and radiation and other treatments that were going on, and then they had their problems with their situations from that: nausea, vomiting, fatigue, diarrhea, abdominal pain, headaches, problems with their vices, whether they're alcoholism, drug addiction, smoking, the whole gamut of things. So his patient population took care of was extremely complex. Now he's doing things for Beaumont to help out to care for people who are failing treatment with other people. But it has just been amazing. And so he is here in our office. People can get consultation with him. He can start treatment with them. We also have Pilates and yoga and actually, I didn't mention that we also have Tai Chi. So it's Pilates, yoga, Tai Chi, nutrition, and medical lectures in our multi-purpose room that's designed to accommodate that. Unfortunately, COVID's kind of knocked that down. So hopefully in the next couple of months, we'll be able to get that back into full scheduling. But for me, it's been always important about education. So the members I care for, if they have better education about their own health and the other issues that are related to health for prevention, and that they know where they can come and start Pilates and yoga and nutrition and Tai Chi and get acupuncture. And then as they start to get better, then they can seek out people who are even better in those programs and use this as a stepping stone to get to that. And they can continue to improve their health. And I also don't like the me concept, meaning that here I am, I'm coming to get health care from you, and it's just me. No, I'm trying to teach my members to go and spread out and say, look, I'm concerned about you. We had this lecture. I talked with my doctor. I talked with these specialists, and I see these symptoms in you, and I'm worried about you. Can you go and see your doctor so that they can take a look at this and see if this is a problem for you? Because we love our friends, we love our family, we love our colleagues. And why should we not spread out and tell them that we're worried about them so they can get their care so they can be healthy too? Because it's a tragedy to hold information that could be helpful to another person.
And Dr. Calado, are these services that you offer, these sort of a la carte services, are they unique to your MDVIP practice, or is this a model that the other MDVIP offices use?
This is a little more unique to our practice. Now, not many, I would say probably less than 1% of the MDVIP physicians could end up having an acupuncturist in their office. I really envisioned our office to encompass everything. So to be able to, to take care of somebody and not have the other services that you're recommending there on site, is something very difficult to really get someone to maybe take and try. So my hopes are is that bringing that here, whether I have a cancer specialist or I have a pulmonologist or I have a cardiologist who's now going to teach us cutting edge things in terms of treatment for heart and lung and cancer. And that way, even if that individual doesn't have that medical condition, they can pass it along to somebody who might have that and say, hey, have you thought about this type of treatment? And maybe, like I'll give an example. So people who have atrial fibrillation is an abnormal electrical problem with the heart. What people don't know is that when they're on blood thinners to try to prevent a clot to have a stroke, it tremendously increases the risk of complications of bleed. And especially as you're aging, each year that goes by, there's an increased risk of an acute hemorrhagic event. And it's just for prevention of stroke. But now there's a new procedure called Watchman procedure where someone can actually have a plug placed into the heart where that's the area that most likely will develop the clot. And that could allow them to come off their blood thinners. But not a lot of people know about that. And so it's things like that that we can start to educate people and say, okay, you may not have that condition, but maybe you have a family or friend who does or colleague. And maybe you should let them know so they can talk to their cardiologist or their primary care physician and start being more proactive about their lives. You know, we get into this, you know, okay, I'm going to see my doctor, I'm just going to get my refills. No, things should be more proactive. It should be looking at what can we do at this visit that maybe we can make you a little bit better. What can we do at this visit that maybe we can take one of your meds off? Not just the status quo. That's not good.
That's so true. It's so sad to see people that sometimes die or deal with serious medical problems just because they weren't proactive, like you say. And so many things are treatable as long as you stay on top of it, you know, throughout your life. So, you know, on that note, I'm sure we could use a whole podcast to talk about success stories and things that make you happy with patients that you've been able to help out or maybe detect those problems early on and get them fixed. Can you pick just one, like in your 6 years at MDVIP, that really stands out? Like, wow, that was really satisfying.
So this one, so she's a lady who, when you look at her, you would never even think that she would have any cardiac disease. So she is under 100 pounds. She eats very bland as her diet. She's exercising all the time. Yet in her studies, after doing all the studies, it's showing that she still had increased risk of cardiac disease. So we sent her for a CTA of her heart, and the CTA showed that she had 70% blockage of the arteries of her heart. Generally, we'll put a stent in or we'll do bypass when a person reached 70%, but she didn't want to. So she wanted to go the medical route. And fortunately now we are living at a time that we actually have a medicine that actually can reverse coronary blockages. We never had that before. Think about all the cardiac meds that we've had for years and years and years. And now we have a medicine that can actually reverse it. So she actually went on that for about a year and then repeated her CAT scan of her heart, and her 70% blockage went down to 30 to 40% blockage in all the vessels. She was a bit upset with her cardiologist, and because the cardiologist kind of said that that's not going to work, that's a waste of time. I said, don't worry about it. Let's just stay on our path and then let's and continue through. And it turned out that her when she learned that her blockages went in reverse, she didn't want to go back to the cardiologist. I said, there are many cardiologists we can send you to. And so she came back to see me, and she actually went to go see that cardiologist. And I said, what happened? Why did you do that? She said, well, I had to let him know a piece of my mind. Because if he's saying that to me, that means that he's saying that to other patients, which means that those other patients are not getting the benefit of something that is just absolutely wonderful out there that they should be on. And so for her, she's really happy. I'm really happy because now she's away from a bad cardiac event with having a blockage of 70% down to 30 to 40%. She'll stay on the medicine and hopefully will continue to regress her disease. And then she actually feels a lot better. She feels stronger. She feels she could do her exercise better because she doesn't have that blockage burden that she had before. So just it's just a wonderful thing.
Fantastic story. And it's just another example of heart disease it's a different, I mean, you could eat right, exercise, and still have heart and feel good and still have heart problems that you don't know about. So that detection, again, so important. So hopefully with this podcast, even one person, if there's one person listening out there that we are able to help with a similar success story like that, hey, that would be fantastic. So how do people subscribe to MDVIP and work with you, Dr. Calado, and how long will it take for them to get in and get started with you?
Well, if they want to know preliminary information on me, they can take a look at mdvip.com. They can type in my last name, Calado, and then they can take you to my page, and there's actually an interview on there, and there's also a video on there of my office. There's more information about my philosophy in my practice. They can either join there, or they can call my office at 248-606-4190, and we can schedule a meet and greet, which means then they can meet me before they make a decision, and they can tell me what their concerns are, and I could tell them if there's something that we can do to help them. Sometimes people have come in to see us because they want to stay with their primary care physician. I said, that's fine. That's actually good. We can actually set up a blueprint for your primary care physician, because then we can consolidate all the information, make some recommendations, and then your physician can follow that. In all fairness, I have not seen anyone go back and they've stayed because they've seen how the outline really makes sense in terms of their care. But we always encourage people, if they want to go back to their primary care physician, it's always nice to get that blueprint. And once they do that meet and greet, if they decide they want to sign up, then they get scheduled for the testing, which takes about an hour, which the vision testing, hearing testing, lung testing, cardiac testing, body mass testing, vascular disease testing, psychological profile, the testing to check for dementia, the grip strength. It takes about an hour. And then they're scheduled about 2 to 4 weeks with me to go undergo the whole head to toe evaluation, which are blocked out for 2 hours to be with me. But if they need to see me before that time, meaning that they don't want to wait and they have some immediate needs, we generally will schedule them that same week with me, that they see me. So I just had a meet and greet this morning, and actually he wants to see me sooner. So we're going to actually either get him scheduled this week or next week, depending on his schedule, because he has a pretty busy schedule, so that we can define some things even before the comprehensive is done.
Very good. Well, there you go. That's how you get a hold of Dr. Calado and his office. And hopefully, again, we can connect you with many great patients. Definitely looks like a great move for you this past 6 years, and best of luck moving forward.
Thank you so much.
All right. Take care.
Take care. Bye-bye.